Vaginismus. I apologize if you're a man, you might not be too interested in this, and I hope it doesn't make you too uncomfortable, but men should know about this too, it's really important. So, what is vaginismus? It is a condition that affects it's estimated about 1% of women have vaginismus, but that number could be kind of low because if you're reading the definition right now, you might be realizing it's something that people would be embarrassed to talk about. So basically, when you attempt to have any kind of vaginal penetration, whether it's with a tampon, an applicator to like treat an infection, whether you're trying to have an exam at the gynecologist, you can't. Your pelvic diaphragm spasms, the vaginal opening clamps shut, nothing can get in, and if penetration is achieved, it's extremely painful. And I'll be talking a little bit more about my treatment in a couple of minutes, but the doctors that I went to, kind of the fourth point there, they sometimes refer to it as a panic attack in the vagina, which can kind of help people understand. It is not something that you're just like, oh, I don't want to have penetration. It's not something you can control. It's like kind of like blinking your eye. Like if somebody comes at your eye with a pencil, it's gonna blink. Like it's the same thing. It's a reaction that gets conditioned with your sympathetic nervous system, which is fight or flight. And your body somehow thinks that in order to survive, it needs to shut off penetration. So go on to the next slide. Vaginismus is really, really hard to have. It's the worst. It makes you really sad. You can't have a consummated relationship. There are marriages that go unconsummated for years, forever, due to this condition. And that is hard. And then there's another piece that goes with that is like the guilt that you carry around with you when you are in a relationship with somebody that you love and you shut down. Like you can't have sex with them. Like it just doesn't work. And you try and you're like, okay, maybe we'll try again later, I'm sure it'll be fine, but it's never fine, and eventually you stop trying because you just give up. When you're ready to have children, it's extremely hard to conceive children if you aren't able to have penetrative intercourse. It's not impossible. A lot of women that went to the same treatment center as I went to conceived like with very limited penetration, but even they gave birth vaginally, they still had the condition. It's not about the size of your body. It's not about the anatomy. You don't feel normal. You feel kind of broken, weird, different than everyone you know, but at the same time, it's like a secret that you're carrying around with you because it's so embarrassing for people to know. And for a long time, I was convinced that I was the only one, like, in the world that had this. And it was only a few years ago when I was just started searching on the internet, like, why can't I have sex, you know? That I found out, like, there's a name for it. It's very lonely, it's really tough. Another thing that I actually didn't put on this slide, well, it's kind of like in the health risks section, like, you could be walking around with cervical cancer and you wouldn't know it because you can't have your pap smear. You could have cancer and you could know it and you wouldn't be able to get the treatment that you need because it's an invasive, like they put something in the vagina to treat the cancer through radiation, and it's not done under anesthesia. You need to be awake. So those are like really big concerns that now, like I'm young, I'm not too worried about that, but it's out there. And not to mention like trips to the gynecologist are just downright traumatic. Before seeking treatment, I had 3 separate attempts to have my pelvic exam, and like I'm not crazy, but all 3 times, like I would be crying, like screaming at them to stop. Like it felt like they were just trying to insert a speculum, but it felt like a knife. It felt like fire. It felt awful. It was real pain, which is, again, like it's something that probably none of you here have ever experienced. But I'm just trying to spread the word a little bit so that hopefully you guys will do the same and people that need the message will hear it. So it does have a name. It is a condition, so there are doctors that say that they can treat you, and there are a lot of things that doctors suggest that do not work. Numbing creams, doing Kegel exercises, like with biofeedback, hymenectomies, like the doctor will say like, oh, the reason that you can't have penetration is because you still have hymen tissue, and we just need to remove that, and then the problem will be solved. Well, it doesn't solve the problem because it's not the hymen that's causing the problem, it's the contraction of the muscles that close the opening. A kind of like recent trend in vaginismus treatment is like injecting Botox into the vaginal tissue to like, I guess, kind of paralyze it so you can't feel any pain, which is really disturbing to me on like a lot of different levels. I feel like anything that they're injecting into you is taking away from your ownership of yourself and your health. Having a glass of wine is a really popular one. Like, you'll hear that like from friends, doctors, anybody. Like even I thought maybe I should just have a glass of wine, you know, but it doesn't work. And I've talked to women who have been like, I had a lot of glasses of wine, and then I couldn't have sex still, and then I was drunk, and it was like really bad. Like hypnosis, sex therapy, psychotherapy, like all these things, they're not really, I haven't met anybody, and I've come into contact with a large community of past sufferers of vaginismus through the treatment center I went to. All I've heard about all these methods is like complete frustration, like why are they telling me to do this? It doesn't work. Relaxation techniques are also another popular one. So this is basically where I was last year, just kind of trying to treat myself. I bought myself a couple dilators that the gynecologist recommended, but I couldn't put them in because it hurt, and I don't know, I needed extra help. So I found out that yes, there is a cure, and that there are these two doctors who are practicing on Long Island, which is fortunately not too far from where I live. Like I was able to go there without too much trouble. So their treatment is a little different in that they call it a body-mind treatment, because vaginismus really is about your body and your mind. It's the physical pain, and it's the nervous system's like fight or flight reaction to and fear of penetration, but it's also about your anxiety and just working through that to kind of reteach your body that like, okay, this is gonna be okay. And basically, for my treatment, I went for about 7 one-hour sessions over a period of like a month. And before treatment was over, like I was completely cured. It was penetration training with like the same kind of dilators I've been using, only like the ones that the one that I had was like this big and like this round, and the ones that I were using there were much bigger, and I was able to progress really quickly with them. It was a really good experience. It's a time that I treasure just because I got a lot of confidence in myself, and just really being able to take ownership of all of my body. Like before, when I was suffering with vaginismus, like the vagina, like I was really kind of freaked out about it. It was not part of my body that I related to at all. I just kind of pretended like it wasn't there. And so the treatment that I went to was really helped me to accept my body and accept penetration. The doctors at the Women's Therapy Center do cure every vaginismus patient who comes and completes treatment. It says like a 95% cure rate. That's their statistic because there are some women who begin treatment and then stop going either because they can't afford it or it freaks them out too much. They don't stick with the program, but everybody who shows up and does what the doctors tell them to do is going to be cured. They're like the experts, and people travel from all around the world. Like people come from Australia, people come from Scotland, England, New Zealand, like any country you can think of. Women suffering with vaginismus travel because they know that the cure is here. And they do have a 2-week program for out-of-towners where it's a little bit more accelerated. So you see them twice a day for 2 weeks. So definitely I feel a little bit vulnerable sharing this with you all just because it's a very personal experience, but I also feel really strongly that if somebody had spoken about this when I was 10 years younger, like I would have gotten to the Women's Therapy Center 10 years sooner. So you never know who needs to hear this. You never know who has vaginismus because they're just embarrassed to talk about it. It could be like your friend, it could be your friend that has kids, or it could be a friend of your friend. I mean, if you work in the medical field, it's good for you to know. It could be the daughter that you're gonna have one day, or your sister, or really anybody in your life. Just, I would encourage you to pass it on. Don't be embarrassed to talk about it, because women deserve to own their bodies, and the cure is out there. So thank you for having me.